this problem at a clip that we never have. And I've been practicing since 19, excuse me, and cough. And I don't ever recall this level of, the focus on superficial sort of achievement and going to the right school and going to, is higher, it just seems like, than it's ever been. And the focus and the competitiveness. And for kids that are, there are those kids who need to be kicked in the butt. And you have to get on them to work. That's fine. But for this percentage of the kids, you're making them worse when you stress performance. And a good coach, for example, knows you don't treat every player the same. Some, when they screw up, you just leave them alone because they're going to be hard enough on themselves. Or you may even need to prop them up a little bit and reassure them that this is part of the deal. Everybody makes mistakes. Others, you may have to get on their case because they're not working hard. But you can't use that same strategy across all kids because these perfectionistic kids are already pressuring themselves enough, and when it comes from parents and teachers, now it's overload, and they become immobilized. They shut down. Believe me, if it works, do it. If it doesn't work, stop it, because you're making things worse. So that's one thing that's really, and these kids are living in this culture of gotta have the right grades or whatever. And a lot of the kids can handle it, but these kids can't. And they are shutting down and becoming dysfunctional in the process. So I also want to talk about some of the unrealistic ways that we handle these kids. Like a kid who is already decompensated into school refusal and absolutely panics if you try to drag them to school. I get the idea that as long as you can get them to school, that's cool. But once they go over this line where they are so disabled, and you dragging them to school every day is just sensitizing them. They're actually getting worse often because they're becoming more afraid of school, not less, because they don't feel in control. It's like a kid who's afraid of needles, and you make them go to the doctor, and yeah, they get their vaccine, but they now are even more afraid to go to the doctor because they were out of control. They were forced to go, and they didn't desensitize to it. They weren't able to become unafraid because it wasn't done in a way that's therapeutic. Now, I'm not criticizing anybody for doing that. You got to get your vaccine shot. I get that. But what everybody needs to understand is how people learn safety. And we forget this with certain kinds of conditions. So let's take the perfectionistic kid. So here'd be a typical thing. They're behind, they've got like 3 incompletes. They haven't been to school consistently the last semester. They're behind in their current studies, they've got incompletes. And parents in the school are concerned about that they might miss out and get a year behind. So they come to you as a therapist and they say, here's what we'd like. I want you to help Johnny get those incompletes taken care of, keep them up on their current classes, and get them over their academic perfectionism. And they will say that, well-intentioned. That's what I would want if I was a parent. But it is ludicrous. It is completely not possible. And so, therapists, you have to be the voice of reason. You have to sometimes have to educate the parents and the school about reality. And what I tell parents is, let me tell you this, that if your child has to miss a class and has to retake 1 year of school, and they're, quote, behind, 10 years from now, that will have 0 impact on their life. 0. They won't even think about it. But I will tell you this, if they don't get the right treatment and they remain disabled, they will still be disabled 10 years from now because you didn't want to get them out of class and put them behind in school. So this is priority time. This is gut check time. This is about what's important and not and us trying to save these kids. So you can tell I'm a little emotional about it because I've seen the dilemmas that these poor kids get in. So what that means is that we got to stop the pep talks and the lectures, trying to tell them, treat them with logic, because it's nothing about logic. We all know, clinicians in the room know that anxiety disorder is not about logic. You got to stop talking logic. You have to give them the learning experiences that they need. I'm going to use the fear of heights metaphor. Oh, this is the other mistake that gets made a lot. And we'll go to the fear of heights metaphor then. So too many times, either because of pressure or because a therapist just doesn't know or is not using an OCD model, they try to incorporate the schoolwork into the therapy too early. And it doesn't go well often because they're ignoring a fundamental principle of how we treat folks. And that is we start with things that they can do. So I want to illustrate this with if you had a fear of heights, and this is a good metaphor for you to use with patients and families that are trying to do something that they're not ready for. So if you ask anyone in this room, clinician or not, what would be the treatment for fear of heights? And I think everybody knows that in some way you go expose yourself to heights. But where do you start? Well, I guess the arrows are giving it away. But even without the arrows, most consumers can tell you, oh, we start the first floor or the second floor. That's right. And when do you go to the third floor? Well, I guess when you can handle the first floor. Yeah, right. When you go to the fourth floor. Well, when you can handle the third floor. Everybody gets that. And then they don't apply that principle to so many disorders that. So where do you think schoolwork is on the hierarchy of tasks that are scary to do? Where do you think it is for an academic professionalism? This is the top floor. So you can't start with schoolwork and expect them to, here's the key, and expect them to do the other two letters. You do the schoolwork, that's the E, you're exposing them to schoolwork, but they can't, they're not ready to follow the response prevention. They can't do it right. They get sucked into their compulsions. And that's not therapeutic. I don't care whether you got your homework done or not. We want you to have therapeutic experiences, not get your homework in. Your parents can do your homework for you and you get it in. So I talk to parents who are understandably, I want to be clear, I'm not throwing stones. I would be doing the exact same thing if I didn't know better as a parent. So when I start talking about stop helping them with their homework, when and if that's appropriate, I'll get the look like, oh my gosh, well, they're not going to get their homework. Well, okay, there's one condition under which I'll advise you to help them with their homework. If you're willing to move with them to college and then wherever they end up in a job and oversee all of their work, then I'm fine with it. Otherwise, we're supposed to be preparing them for living a life, a functional life, independent of you. And it's time to start. So here's what it looks like. Now, you can't read this, but at the lower one might be writing an email or just a note to a friend without ritualizing. Then further up, maybe we make up mock schoolwork. It's not real, it's not going to be graded, but it's like schoolwork. That's maybe in the mid-range. Then when we do get to homework, it would be easy homework and hard homework at the end. And as you'll see in the case demonstration, it's you'll see the difference between using schoolwork as exposure versus actually trying to get your homework done. It's not the same. All right, here's a warning. If you do escape school, it could follow you to your occupation. Don't you think that's Martha Stewart's story? I did notice, I don't want to call her and upset her, but a couple of those roles are out of line. Yes, sir?
Yeah, I have a question. For some people, their perfectionism gets them into law school, medical school, and graduate school. And managing a child is somewhat easier because they have a family at school. What experience have you had with people at the higher level of education?
Well, that's kind of a nice question. It's kind of a segue. Just coincidentally, I didn't hire this man. But you're segueing into actually something I was going to talk about here. So workplace perfectionism, a lot of the same features, a lot of the same issues, although certainly financial consequences can be greater. But there's something that I call the Peter principle of perfectionism. I think that's what you're starting to get at. Any of you old enough to remember the Peter principle years ago? You're not going to admit it if you are, probably. But, of course, I wasn't alive when that came out. My great-great-grandfather told me about it. It was a business principle that people get promoted. They do good work, and then they get promoted, and then they do good work, and they get promoted. Eventually, they get promoted to the level of incompetency. So if you're successful enough, you'll finally find the job you're not equipped to do. Which is an interesting concept. So how does that relate to perfectionism? Well, because as life progresses developmentally, your life gets more complicated. So you might be pretty perfectionistic as in college and maybe get by, but you have no life, but you do get good grades. You spend longer time on your homework than the other kids and whatever, the other students, but you get by. And usually a great sacrifice, staying up all night, whatever. But you maybe, if your only thing you're doing is law school or whatever, and you're not doing anything else, you can devote 24 hours a day to that and maybe survive. Then you get older. You get a spouse. You buy a house. God forbid, kids. That's the deal breaker. Now you're going to PTA meetings, and blah, blah, blah. And look at all these things you have besides your job. And that's where, so you'll see people that got by, and they get sort of clinical in their late 20s or the 30s or the 40s. And they say, I don't know why, just now I can't. But a lot of times it has to do with, they got by, but if you get the details of how they got by, it wasn't much of a life. But they were functioning in the superficial ways of, they were passing their classes and sort of getting by. So that's the sort of Peter principle of perfectionism, where you see people get to their level of incompetency with perfectionism, that they have too many things demanding their time and they can't do them all perfect. So this is Sam. Sam was an architect. Let's see how we're doing on time. Okay, I think we'll be okay. So Sam was an architect. Man, look what he's worried about. Now, there are certain professions that you want people to be perfectionistic in, at least the positive part, right? I don't want my surgeon going, I might wash my hands out. See if I have time. Yeah. I kind of glanced at your CAT scan. I didn't have much time. You ready? So architects, that'd be one you're a little bit, at least you got the perfectionistic striving stuff down. I would be good with that. Functional amount of checking and double checking. Yeah, that'd be good. But Sam was not that. Sam was having all sorts of trouble at work because he would get a design done, but it would take an inordinate amount of time. And he would be staying up at work till wee hours in the morning, checking and double checking his work over and over again. And his wife was, very frustrated and upset that he was never there for the family. And so his life was dysfunctional. Sam was one of those ones who kind of got by. We were just talking about who, when he went to architecture school, that's all he did. And he had no life, and he kind of got by. But once he started having all these other responsibilities, he wasn't married. No one complained at 2 in the morning when he came home, when he was in school. But now he's got kids and a wife who expects him there. So what are the signs of dysfunctional perfectionism? See, unlike kids, you have parents that are checking on them, who kind of see the signs earlier than the adults. But if you're working and you're an adult, there's no one necessarily looking over your shoulder except maybe somebody at work. And sometimes it's a long time of dysfunction before supervisors catch on. So they may hide their imperfections and their avoidances, so they don't want to reveal it. So in the research on workplace perfectionism, there's sort of 3 factors, sort of 3 areas that people have looked at. One is work engagement. In other words, how much do you really engage in your work, and in a mindful kind of way, a good way, that you really get into your work. Workaholism is more the hours and the level of intensity of your work, not necessarily talked about as a bad thing, although we usually use it as a pejorative. But as you'll see, there's different kinds of workaholism. Not everybody who's a workaholic is unhappy or dysfunctional. And then there's job burnout. So, reminding you again of the two types of perfectionism, strivings and concern. Strivings are functional, generally. Concerns are dysfunctional. So what's the research say on work engagement? That perfectionist strivings have a positive relationship with engagement. In other words, the more you have perfectionistic strivings, the more you're engaged in your work, and again, in a positive way. Perfectionistic concerns have no relationship to your engagement in work. What about workaholism? Well, this is both perfectionistic strivings and perfectionistic concerns have a positive relationship. In other words, you could be working long hours and intensely for both reasons. Now, you can guess you're probably more efficient if you're a striver than a concerned person, but both of them have a positive, and by positive relationship in science, we don't mean good. We mean that the more of this, the more of that. That's what positive is. Negative relationship is the less of that, the less of that. So, the more of that, the less of that. So in this, the more you strive, the more you're concerned. There's a positive relationship you're more likely to be a workaholic. But here's the key one here, which is job burnout. If you are a perfectionistic striver, you are much less likely to burn out. But if you're
perfectionistic concerns, dysfunctional perfectionism, you're much more likely to burn out. And here we see one of the most signature symptom of burnout is your head exploding. It happens many times. So don't do that, really. So, is there any hope? Well, yes, there is. There is hope. And it's called treatment. So, I'm trying to figure out, we just got a few minutes, but it doesn't look,
It's not that they're ready.
Yeah.
they're not ready.
I don't think so.
Yeah, okay.
You need more time?
I need 5 minutes.
Okay.
Oh, perfect. Okay, so what I'm going to do then, it's just going to work out fine. So I'm just going to summarize what the treatment is. Then we'll go nutrition. And then we'll come back and we'll have a case, the case of Jack. And we'll go in depth in the second part of this talk in what treatment all involved in Jack's treatment. And Jack's a great example because he was in nursing school. So there's aspects of what you might encounter in occupational perfectionism also with academic perfectionism. So let's talk about just kind of an overview of the treatment, and then we'll take a break, and then we'll come back and hear about Jack after that. So what about medication? Well, there's no reason to think the medications that are used for OCD wouldn't also be appropriate for perfectionistic disorder, and certainly in our clinic, we would think about the SRIs, the SSRIs, the Prozacs, the Luvoxes of the world, and then go from there. Of course, it depends on whether there's also accompanying depression and things like that. We generally would not use benzodiazepines, like Valium and Xanax. Generally not, for a whole variety of reasons, which most of the clinicians know. There is also an issue sometimes of ADD or ADHD with some of these folks. Sometimes there isn't any ADD, it's really OCD. But the distractibility is them worrying. They're up in their head doing mental rituals, and it's not really classic ADD. In some cases, they do also have ADD, and the medications that are appropriate for that might be worth trying to help them focus. It really has to be taken case by case. So cognitive behavior therapy is the treatment, at least in our clinic, the main clinic treatment for perfectionism. This is Professor Gallagher's controversial technique of simultaneously confronting the fear of heights, snakes, and the dark. So I like this because it illustrates everything that CBT isn't. It isn't the mad scientist doing things to the patient against his or her will. So this is a great slide to use in community talks when you're trying to debunk some of the myths about CBT, because a lot of people have these ideas that are sort of fantastic about what happens, and nothing could be further from the truth. It's really, if it's done right, it's a collaboration between you and the patient. Now, the only exception to that is Edna Folo. Edna can just tell people to do something. But the rest of us mortals have to have a therapeutic relationship with their patient. Okay. She calls me all the time, tells me what to do, and I just empty the trash. Why am I doing that? Why are you calling me from Philadelphia? So what are the components of CBT? Same with OCD treatment. You can package it different ways, but you can kind of think of these kind of four components. One would be engagement. You got to get people engaged in the treatment. You can't just start rushing into exposure work with folks, because there's a lot of misconceptions that I was just mentioning. And also, you've got to get past intellectually, you've got to have them understand why this is in their interest. And so you may do some thing that we call motivational interviewing as therapists, trying to get people clarifying why they're doing this. And you have to maybe sometimes deal with some of those mistakes, those beliefs that are so rigid about, well, if I can't, if you're not first, you're last, or whatever the rigid belief is. If they really don't see alternative beliefs that promote functioning but are not so rigid and dysfunctional, they may not buy into the treatment. So the first thing is to really get them so that they engage in the treatment. And then you're educating them about, whether it's, as I said, challenging those perfectionistic beliefs. Then you're going to set up an exposure and response prevention. And sometimes your worst enemy will be the person who's perfectionistic, because they are going to unrealistically sometimes want to do the harder things, and they're not prepared to do the response prevention. So if I'm going to write a letter to my friend, that means that I write the letter without changing, rewording, erasing, or whether it's actual handwritten or word processed. I have a time limit on it that I'm going to send whatever I get done within that time limit, and I do. I can't go past that time limit. There are ways, as you'll see with Jack's case, how different it is to do something as ERP versus just trying to get the task done. And then skills training, often it's not unusual for us to need to do skills training, time management, study habits, how do you write a paper, teaching how to do that. Um, because some of the skill deficits are related to the misconceptions about the shoulds. I shouldn't have to, I should be able to just produce a perfect draft from free flow from my mind without having to edit and all these unrealistic expectations. So, so that's kind of the components of the treatment. How long that takes can be anywhere from 3 months to 3 years, depending on what the ups and downs, the obstacles. Jack's treatment was over, I think, about 1.5 years. Not that we, partially because there were some obstacles that got in the way that delayed treatment for a while. He was afraid to drive, so he couldn't always make it to the clinic. So we had to first address his fear of driving and get him over that, so we could then get him to the clinic to do therapy. So, options for treatment, everything from self-help books, internet resources, standard outpatient therapy, intensive outpatient, family intervention is very helpful. Parent coaching, sometimes parents are taught how to do the coaching, and then in more severe cases, residential treatment. Now, it might at first blush look like, why would you do residential treatment if the problem is academics? Because they often are perfectionistic in fundamental things of life, not just perfectionism, like getting ready in the morning and dressing. And those are things that can be addressed, and getting on a schedule, and a sleep schedule, all of those things. This is in the more severe instances. So here are a few books. They're in your, should be in your handout that are on. There are other books. These are just books I know the authors and have confidence in them. So there are other books perhaps that are excellent. I just don't, I didn't list them because I'm not familiar with them. And actually, Jeff Szymanski, the president of the OCD Foundation, wrote one of the books on perfectionism. The Australian Center for Clinical Interventions has a lot of great resources. And you say, why Australia? Well, because Australia has a different healthcare system than we do, and they actually care about prevention, and we don't. So they realize that the more information, the more resources they provide to their population, they are lowering their costs, their healthcare costs in the long run. It's a very different mindset, and anybody who doesn't think behavioral psychology is not relevant, the contingencies do influence people's behavior. And of course, I'd be remiss to not mention the OCD New Jersey website, and also the international website, and also Anxiety and Depression Association of America has some information as well. So we'll leave it at Jack's story. Did you want to say a few things, Alan, before we adjourn? Okay, please don't adjourn yet.